Hi there friends, my name is Dr. Ashk Pramchand and I'm going to show you my life as a psychiatry intern and our calls in the emergency department. Stay tuned, sit back, relax and enjoy. Hi there, so this is our psych clinic seminar room. There are rooms just outside here where we see patients, we do a quick assessment of them, we assess if we need to change any of their medication, and we arrange follow-up for their treatment as necessary. Most psych patients that we see have been sick for a long time and require chronic assessment and multiple visits to the clinic. And here we are, another fantastic day in the psych clinic. It's pretty cozy, nice desk here where you can see your patient and write notes, and we spend most of the day here just pushing the queue, seeing as many patients as we can, and adjusting their medication as necessary. We have another beautiful day in the psych clinic, at least for our final week of our psychiatry rotation, and I'm looking forward to a few more fascinating and enlightening patient encounters. And what another beautiful Friday afternoon it is. Days are our academic days. We usually start the morning with an 8:15 a.m. meeting, followed by our standard rounds and a presentation by one of our senior doctors. Later on in the day, at around 11, we would then be requested ourselves to present a relevant case that's been allocated to us based on common psychiatric conditions that we would encounter, especially those that we would see in an emergency setting. Over the past few weeks, our work in the psychiatry wards has followed a fairly consistent pattern. We started the day by doing our ward rounds, usually with at least one or two of our seniors. The patients come to us. Our seniors would then give us instructions once the ward round is done, which we would then note down on our job list. And this may usually include things like doing blood tests for the patient, inserting IV lines, making calls to the relevant members of the multidisciplinary team to help coordinate management of the patient. Good morning, and hi there, it's Dr. Ash, and today I'm going to take you through a casualty call at my hospital. I've just returned home now. We finished our day shift in the psych clinic, and in the evening we'll be heading off to the hospital once more for our evening shift in the emergency department. Okay, it's nearing 8 p.m. I am ready to head off for the night shift for all my essentials in my Pikachu bag here, including something to eat, a bottle of water, a bottle of milk, which for some reason I find exceptionally satisfying to drink on call. And yeah, let's go for it. So this is the call room where I will be spending the night. It's pretty comfortable and has the basic amenities. You've got 2 beds here, a sink, a nice desk here, a phone in case the nurses need to contact me for anything. And yeah, and for some reason there's a lot of files here, so it serves as like a storage facility as well. It is 4:49 in the morning right now. This was a pretty good casualty shift, I will have to say. We didn't see too many emergencies. There was one patient who had multiple Shambok injuries, so that's sort of like a whip where the assailant hits the patient multiple times in various parts of the body. And the surgery team needed to assess the patient for what we call crush syndrome. But fortunately, I had the chance to suture up a lot of lacerations he had on the ears, which was causing a lot of bleeding. So we managed to stop that, and hopefully he's doing a lot better now. We also saw a few interesting surgical cases, some minor trauma cases. Those are pretty easy to manage, and we sent all of those patients to the departments that needed to assess them. Somehow an Egyptian goose managed to fly into the university. And there you have it, folks. A casualty call finished. It's now 13 hours since we started our shift. Around 8 a.m. I finished off helping a patient with a fracture to his left shoulder and a vertical fracture at the level of C1. So the orthopedics teams are helping us manage those patients. We handed over, attended a brief psychiatric administrative meeting, and now we're here, ready to head home and get some rest. Hopefully we'll do something more productive a bit later in the day. Just finished a 12-hour casualty call. There we go, folks. You've seen what life is like as a psychiatry intern, and thanks for joining us for the 12-hour shift.